Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Parainfluenza versus influenza symptoms and treatments. Parainfluenza and influenza, the flu, are not related conditions, despite their similar names. Parainfluenza is caused by an entirely different virus, known as the human parainfluenza virus, HPIV. It is a common virus that can cause both upper and lower respiratory infections, including colds, bronchitis, croup, and pneumonia. /r/n/r/n This article looks at the differences between parainfluenza and the flu, including their symptoms, causes, and treatments. /r/n/r/n Rebecca Taxi, Getty Images /r/n/r/n Although parainfluenza and influenza both cause respiratory illnesses, they are caused by different viruses. Parainfluenza is caused by the human parainfluenza viruses, HPIVs, whereas influenza is caused by one of 4 different types of influenza virus, A, B, C, and D. /r/n/r/n Although symptoms of parainfluenza are usually milder than the flu, symptoms can sometimes worsen and lead to bronchitis, croup, or pneumonia. Vaccines and antiviral medications are available for the flu, but they don't protect against or treat parainfluenza. /r/n/r/n This table summarizes the differences between parainfluenza and influenza. /r/n/r/n Parainfluenza viruses are common causes of respiratory illness. Parainfluenza infections are most likely to occur in the spring, summer, and fall. Most cases of parainfluenza occur in young children, but you can get parainfluenza at any age. /r/n/r/n There are 4 different types of HIV. /r/n/r/n Symptoms vary depending on both the viral type and the individual. /r/n/r/n After exposure, it takes between 2 to 7 days for symptoms to develop. Most of the time, the virus causes an upper respiratory infection, which may include the following symptoms. /r/n/r/n In most cases, symptoms are not severe and may be similar to the common cold. Sometimes, however, symptoms can progressively worsen and may lead to lower respiratory infections in the main bronchial tube of the lungs, bronchitis, the smaller air passages, bronchiolitis, or the lung itself, pneumonia. /r/n/r/n Symptoms of lower respiratory infection may include /r/n/r/n Children under 18 months of age, persons with weakened immune systems, and the elderly are most at risk for severe parainfluenza symptoms. Call 911 or go to the emergency room if a person is having difficulty breathing. /r/n/r/n The parainfluenza virus is transmitted by coughing and sneezing or by touching objects that have HPIV on them and then transmitting the virus to your nose, mouth, or eyes. /r/n/r/n As with the cold and flu, parainfluenza can be easily passed from person to person. The virus itself is quite robust and can live on surfaces for up to 10 hours. As a result, it can spread rapidly through places where people spend a lot of time in close quarters, such as daycares and elementary schools. /r/n/r/n In otherwise healthy people, parainfluenza is typically diagnosed by reviewing symptoms and ruling out other causes. Those with compromised immune systems may undergo additional testing to determine the strain affecting them. Your healthcare provider may also take a throat culture or nasal swab to rule out other pathogens, such as influenza A. /r/n/r/n After examining you and listening to your lungs, your healthcare provider may order imaging tests, such as a chest X-ray or computed tomography, CT, scan, to check for pneumonia and determine the right course of treatment for you. /r/n/r/n If symptoms are mild, there is usually no need for medical intervention. In cases of fever or body aches, Tylenol, acetaminophen, or an over-the-counter, OTC, cold and flu remedy may be used. Children and adolescents should not take aspirin. Read other product labels for the recommended age for use. /r/n/r/n for moderate to severe croup. Steroids, typically dexamethasone, are given orally or intravenously. Is only possible if the patient is not intubated or vomiting. Epinephrine, if given, is administered by inhalation via a nebulizer. For adults with pneumonia caused by parainfluenza, treatment is supportive, i.e., supplemental oxygen and/or ventilator support, and sometimes includes inhaled bronchodilators, such as albuterol and/or corticosteroids. /r/n/r/n secondary pneumonia is typically treated with antibiotics. /r/n/r/n parainfluenza transmission is prevented the same way as the cold or flu. /r/n/r/n parainfluenza is not usually serious. Most people start to feel better in about 7 to 10 days. /r/n/r/n infants, older adults, and people with weakened immune systems are more vulnerable to experiencing serious illness, including bronchitis and pneumonia. If you or your child develop a barking cough, wheezing, chest pain, or shortness of breath, seek medical attention. /r/n/r/n parainfluenza is more common than most people realize and, in most cases, is not of great concern. In fact, most people won't know whether they've caught a cold or PIV, and it usually doesn't matter. However, if symptoms worsen or persist, don't hesitate to seek medical attention. /r/n/r/n/r/n/r/n thank you form.email, for signing up. /r/n/r/n there was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.